the other things that we have done. So with that, I would be happy to yield the floor so I might hear my distinguished colleague, the senior senator from West Virginia, speak for a few minutes.
Madam President, after that
Senator from West Virginia.
After that last sentence, I had to drink a little water sort of to balance myself out. To be praised at such length by Senator Schumer is, you know, one can't take it lightly. I wanted to make a few comments on the health care bill, which in and of itself interests me, because we're here doing FAA. And if I remember correctly, I stood here at excessive length and gave a speech about the importance of the FAA bill, and Kay Bailey Hutchinson did the same. And then all of a sudden, here we are on health. But, and that's very interesting, because here we've sort of opened and made ourselves entirely transparent. Anybody can offer amendments. Leader doesn't fill up the tree. So it's open. And what happens is immediately everybody pops in with their favorite amendment. And I don't resent that. I'm just saying it's an interesting phenomenon which is showing itself on the very first day. And whether that's going to last or not, I don't know. But in any event, I think they're still working, Senator Baucus, Senator Hatch, others are working on the FAA, some FAA stuff, and the 1099 matter. So I wanted to talk about a couple things about health care. I think it's really important that I mention this in my earlier comments, that when you talk about the American people don't want this bill, there was a period of time when that was correct, because the bill was made in front of everybody on C-SPAN, whoever watches C-SPAN, but enough people did because there were a lot of people who were interested in what was happening. And it wasn't a very pretty process. I mean, you know, the public options, for example. Well, Al Franken and I put a public option bill on the floor. We thought it was going to save the world. And then all the talk shows took it up, either blasting it or loving it in excess in both cases. And there was only one little problem with the public option. It didn't have any votes in the Senate Finance Committee, which means it couldn't have gotten very far. And we did our public option, which was based on a $50 billion Medicare benchmark. So, I mean, it was a real cost saver, and a very, very good, obviously, go into get a nonprofit option as you buy your health care. That's very appealing. All of which is true, but all of which was unpersuasive, because it sounded like too much government. Maybe if we called it the freedom option or something, it would have been different. I have no idea. But anyway, it doesn't matter. It didn't get the votes. My version got 10 votes. Chuck Schumer gave another version. It got 8 votes, or I guess it was the opposite. And it didn't matter, because we then came up with the medical loss ratio, which, of course, nobody proceeded to understand because it's such ridiculous wording, except that it works. So I want to talk about just a couple of things like that until somebody comes, and then I will humbly and gladly yield the floor. But does the Senator wish to speak? Okay, I will not be too long, although for me that's not a safe statement. As it happens on the poll, when people over a period of months and months and months, they saw this thing happening and they didn't like it, and people lined up on one side or another, mostly it was the other, and they didn't like it. Well, it turns out that New York Times, CBS, and I don't necessarily have to trust them, do I? It's because they took a poll. I mean, I don't trust polls. But it says that 80% of Americans oppose repeal. I just found that inside the cloakroom in there, because I don't sort of live by polls. But that's based on January 20th of this year. Well, let's supposing it's off by 10%. Let's supposing it's off by 15%. One thing that becomes clear from the generalization of that number, certainly can't go higher, it could go lower, in fact, is that people don't want repeal. And so then that takes you to, well, what if we do have repeal? What does the repeal then lead you to a thought-out process that would then be substituted for what we created and the President signed? And then very quickly one comes to the realization that there isn't an alternative from the other side. There never has been an alternative from the other side. And from that quickly follows the deduction that what they want is the present system. And if that's not true, then they can come down and tell me about that. But that's what I have to believe, because I haven't heard the new ideas of the alternatives to what it was that we worked on and accomplished over a very difficult period of many, 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 many months, and much angst and agony and screaming at town halls and all the rest of it, all of which was worth it, because the bill, although not perfect, was a real step forward. And I've talked about it sort of looks at the fee-for-service system, which has always been a fallacy in the American healthcare system, that you automatically get paid for whatever it is you do. If you're a doctor or hospital or you sell medical equipment, you just get paid for what you do, no questions asked. You don't save money. You don't improve health care by doing that. Productivity, efficiency, excellence is done by oversight, by accountability, by asking questions, by asking people to show through the evidence of what they've done for a particular service that it's better than it was the year before. And I mentioned unpleasant, probably not fit for this floor, but one of the biggest problems we have in health care in this country today is something called MRSA. Well, MRSA is in every hospital in the country, almost every hospital, and unfortunately it emanates for the most part from bathrooms, that bathrooms aren't kept that clean. Well, so if we don't do our bill and it's repealed, and so hospitals then are not judged upon what MRSA and many other things, too many MRIs in one hospital or too many MRIs in one town that can only support 2 but has 7 because you can make money off of them, but they're not used very much. All these things have to be checked and looked at very carefully before people are paid. That's the way you save money, and that's the reason that the health care bill, which was finally signed, saves $1.3 trillion over 20 years, and $240 or $80 million in the very first year. It's a cost saver. So by definition, if we went back to the present system, you'd have to start with the fact that we would be losing that saving and therefore adding it onto our deficit. So we'd have $1.3 trillion more in deficit over 20 years, and et cetera, et cetera. It's unwise. It's unwise. But then cost isn't absolutely everything. We understand that. The senator from New Hampshire certainly understands that. I mean, we have to use good judgment. So then you look at the public option, which didn't work. Then you look at the medical loss ratio. And a lot of folks don't know what that is, even today, even in this body. But it's a very simple system where you simply say, and it will disappear if Senator McConnell's amendment passes, that insurance companies, health insurance companies, are required to spend 80% of all the, or 85% if it's a large institution, 85% if it's a small business or an individual, it's 80%. They have to spend that percentage of their premiums that they collect on health care, and then have to show that to HHS that it's being spent on health care that makes Americans better, or at least keeps them where they are, and the bathrooms get cleaner, to be crude about it, but actually quite accurate about it. Now, that's a very good system, because it isn't sort of mandating or, it's called oversight. The American people should want to do oversight over their health care dollars because it's so much of their income they have to spend on health care. And the medical loss ratio, very strange name, but a very sound principle, 85% or 80% of all premium dollars has to be spent on health care. And that the health care can't just be health care, but it has to be better health care than it was in the previous year or the previous 2 or 3 years. Obviously, we're not into that system entirely yet. Won't be entirely until 2014. Is it possible for me to explain that I'm very disturbed that this bill that we're now wanting to repeal insures 32 million people that don't have health insurance? And then I'm saying to myself, Madam President, the 32 million, there's a lot more than that who are uninsured in this country. That's all we could afford to do because we didn't have enough money. So let's say it's really 45 million looking out into the future. And then let's decide that there are a lot more than that, many millions more than that, who are underinsured. So you may be dealing with 50 million people. And all of a sudden, their prospects for getting health insurance disappear. They just simply disappear because we repealed the bill. Now, truth in telling, the 32 million people, we weren't going to be able to get that all done until 2020, again, because of lack of funds. We had to do as much as we could, as soon as we could, but we couldn't do it more than that because we didn't have the money. And everything was scored by CBO, which, as everybody knows, is very tough. But I'm astounded. I'm astounded by the prospect of the excellent people who are on this side of the aisle. Excellent people. They're like us, different party, you know, so what? But that they would say 32 million lose their health insurance. They were going to get health insurance, but now they're not going to get health insurance. So they're on their own. So what happens then? Well, they take up the practice, which I saw first when I was chairman of the Children's Commission for 4 years in the early 80s, late 80s. And we went out to Chicago, I remember, on one visit to Cabrini Green. And Chicago is a robust healthcare city. And the folks out there told me that in that particular year, 8 emergency rooms had closed down in hospitals. Why? Because they were being overwhelmed, then even. Secondly, they're by far the most expensive part of a hospital. They cost the most. They drain the health care because it's all emergency service. People wait for 5 or 6 hours. We've all been through it. And then, they get their health care maybe, but it's so inefficient. It's so brutal, such an awful system, where more attention, because of health insurance, would allow more cautious and attentive, logical work to be done on patients. So that's gone. That's simply gone. Emergency rooms are really important, but a lot of them are going out of business because they still can't afford to stay. They're too expensive for the hospital corporation that makes that decision. I don't blame them for that. Then I think, and I'll try to, because I know my colleague wants to speak, I think of when I was a VISTA volunteer, and I sometimes talk about that on the floor, a long time ago. And we depended upon something called, there were no jobs, there was no health care, nobody went to school because the school bus didn't come to pick up any of the kids because we were considered too far away. And so it was kind of a bad community. I really latched onto that community. It's the reason I went to West Virginia and then stayed in West Virginia. They depended on a rural community center. And it was right next door, the Lincoln County Community Health Center. And it wasn't a hospital, so they didn't have to worry about going up in an elevator because many of them in very rural parts of many states haven't been in an elevator before. They haven't crossed a traffic light, which is red or green. All of that's new to them. They just live out in rural places, and they deal with it that way. I expect it's a little bit true in parts of New Hampshire, although New Hampshire's gotten very sophisticated. But rural community health centers, people trust. Why? Because they're not hospitals. Because they're on the first floor. They're an old Kroger store, an old Safeway store, an old something store, hardware store. But inside are doctors and nurses, and now with health IT, which is in this bill and heavily promoted, which may be coming on its own, but I doubt it. I mean, this bill, I think, is really important to it. They can communicate with anybody, any university, any medical center, not just in West Virginia, but in the world. And they can get experts to look at, let's say, a mole on a 14-year-old's arm. Is that just a mole or is that cancer? And I've seen that done. I've seen that done. A doctor at West Virginia University, this was 20 years ago, I can't believe that, looking at a kid in Moscow with a physician's assistant attending, and they put the then technology on that mole, and the doctor in West Virginia was able to analyze it and say it is not cancerous. So, you know, that was a wonderful event. But community centers, people gravitate to. Poor people gravitate to them. Rural people gravitate to them. They're easily accessible. They have very good doctors. There's a lot in the bill to help with that kind of doctor, that kind of nurses who would staff those kinds of places, and the whole health IT issue, which makes the work they do there checkable, accessible anywhere else in the state or in the country or in the world. Those would be gone. We have $10 billion in our bill for 1,000 new community health centers all across America. I'm excited by that. I think that's great for rural America. And a lot of America is rural. Most of America is rural. That goes. So then I think about subsidies for small business. I spoke to a Chamber of Commerce part in a rural part of West Virginia, conservative part of West Virginia. They didn't like the bill. That's why I went there. And they were all small business people. No big businesses down there. And I spent 3 hours with them, Madam President. And I went through the whole health care bill. But what was unusual to them is I stayed around and answered all their questions. And that was interesting. In other words, you don't just sort of say, this is good, this is bad, here I am. You say, have at me, and I'll answer you as best as I can. And where you don't agree with me, you tell me that. They had no idea that they get 35% tax reduction, you know, the tax credit for doing, giving health insurance. They can't afford to give health insurance. Maybe 35% isn't enough, but they get that. And they get that until 2014, and then after 2014, it goes up to 50%. They didn't know that. And all of a sudden, the possibility of keeping their employees and doing the right thing by their employees, because people in New Hampshire, people in Wyoming, and people in West Virginia care about each other. That's one of the beauties of small states. People really care. They want to do the right thing because they all live together. They don't commute out to the suburbs. Not a lot of suburbs around. So that was really impressive to me. And when I left, I got a standing ovation. Now, I'm going to put that aside because I really still can't believe that standing ovation. But what I do believe is that they were interested, that at that point they didn't know it was in the bill, and there was no reason why they should have known it was in the bill. And then somebody who'd been a major part of writing that bill comes and talks to them and answers all their questions, at which the end point of which is 3 hours, and I get up and leave. So that perplexes me. If the minority leader's amendment prevails, in that I don't think there's an alternative coming, we go back to the present system, so that all goes. Now, the senator from Wyoming, when he speaks, may say, oh, yes, there is an alternative, and, of course, we'll have to listen to that. And if we do an alternative, you know, that whole negotiation may be 2 or 3 more years. I don't think people can wait that long. But in any event, then I worry about the donut hole. You know that. It's so unfair that seniors pay up to a certain amount and they get their prescription drugs. They keep paying the premiums, but then for up until $5,000-something, from $2,000-something to $5,000-something, they have to keep paying their premiums, but they don't get any prescription drugs. That's the donut hole, which we close. Again, not until the year 2020, but they know it's going to close. And that's gone. That's gone. So they have to work the system as best they can, pay their premiums if they can, and if they can't, they're just out of luck. They'll get cut off. I won't go into I'll just say that, to me, the pre-existing conditions for children in particular, which starts right away, which is in effect now, is so brutally devastating if it disappears. A child comes in. While I was speaking before, I talked about a kid, an 8-year-old kid that had cancer, a 9-year-old kid who had cancer. But he was killed by the fact that he couldn't get any treatment because of annual limits, and that's in effect now. And no, lifetime limits is in effect now, and annual limits comes in effect in 2014. But he died. And I was a friend of that kid. I met with that kid. I met with that kid's parent. I keep in touch with him. He died. He couldn't get health care under the present system. Under our bill, he would have gotten health care. Now, you could say maybe he was too late. But that doesn't matter in the sense that he's just an example of somebody who's sick, who could get health care, and otherwise they couldn't get health care. And so he died. And I'm haunted by that because I remember his face. His name was Sam. He was a lovely kid. And he's not around any longer because of the old health care system. So let me just conclude by saying that I don't think that, health care is a very hard subject. It uses all kinds of words and acronyms. It's true in the Federal Aviation Bill, too, if we ever get back to that. But acronyms aren't bad. They're just not friendly. They still mean something. And because something's complicated, it doesn't mean that it's bad or wrong. It just means that it's complicated. Healthcare has to, by definition, be complicated. And people have to understand how the parts work together. Very, very hard to do. But I would just plead with my colleagues to be cautious about repealing something which is in place, which appears to people just don't want to see it repealed. They certainly want to give it a chance. They certainly are beginning to see the benefits from it. We're already reading about those things, and it's just started. It's just literally started. So it's a month and a half old, or a month old. January, yeah, it's a month old. So I would just say that we need to be cautious about that, but particularly on repeal if it means going back to our present system or any substantial part of our present system. That would be a tragedy. I thank the presiding officer and yield the floor.
Madam President.
The senator from Wyoming.
Thank you, Madam President. I ask unanimous consent that when I'm finished with my remarks, the junior senator from South Dakota will be allowed to speak.
Without objection.
Thank you, Madam President. Madam President, I come today to support Senator McConnell's amendment that we repeal this health care law. I listened very carefully, and I listened to the people back home in Wyoming. In Wyoming, the University of Wyoming conducted a survey, and 68% of people in my home state want this law repealed. The people of Wyoming have great concerns about the unfairness of the law. People on Medicare, our seniors who rely on Medicare, are concerned with the unfairness of a law that takes over $500 billion from them, from our seniors on Medicare, not to help Medicare, not to save Medicare, not to secure Medicare, but to start a whole new government entitlement program for someone else. Let's look at the specific cuts to Medicare. $155 billion from hospitals, $202 billion from the 11 million seniors on Medicare Advantage. And there's an advantage to Medicare Advantage. That's why so many seniors have signed up for it. Nearly $15 billion from nursing homes, another $40 billion from home health agencies, and $7 billion from hospice. Now, the President, the other night in the State of the Union, said if you have some ideas on ways to get down the cost of care and improve care, I want to listen. Republicans have been bringing ideas to the floor during the entire year-long debate, and those ideas have been ignored and rejected. Well, I'd suggest that the President listen to his own debt commission. He appointed the commission. They had a lengthy discussion. And what the members of the debt commission have said is that if you cut Medicare, a program designed for seniors, Don't do what you did. Don't do what you suggested, Mr. President. Don't do what the Democrats in the Senate have suggested. Don't do what Nancy Pelosi wanted. If you cut that kind of money from Medicare, the Commission says, you should use that to help and save Medicare, not start a new government entitlement. The Commission also said that we should repeal the Class Act. That's a part of this health care law. It's called the Class Act. It has been described by Democrats as a Ponzi scheme that would make Bernie Madoff proud because of the fact that they use trickery, gimmicks, to say we'll bring in money now and the big costs won't show up until 10 years from now. And I heard my distinguished colleague from West Virginia talking about small business and the tax credits. The small business owners in Wyoming look to that. What they found is if they want to hire an additional worker, if they're at 10 or 11 workers and want to go to 12, they lose part of the credits. And you know how low-paid jobs they have to be to get the tax credits? The average income has to be $25,000. Can't be higher than $25,000 a year. So if you want to give someone a raise, you're going to lose your tax credits. Small business owners across the country who look closely at this have said, this doesn't help me at all. They're saying we need to make it cheaper and easier to create private sector jobs, and this health care law, with its expensive mandates and obligations, makes it more expensive and tougher to create private sector jobs. We want this bill, this law, repealed. Madam President, just yesterday, the court in Florida ruled that this entire health care law was unconstitutional. There's been a separate ruling in Virginia prior to the beginning of this year. I will tell you that that ruling in Florida yesterday is a second stake in the heart of this health care law. This government, this Senate, the House does not have a right to go into the homes of the people of my state of Wyoming or anywhere around the country and say to them, you must buy a product. You must something. If the government does it stop. And that's why I'm encouraged, as are Americans all across this country, when they saw the ruling coming out of Florida. People inherently understand that this is unconstitutional. The health care law even fails to meet the President's own promise. You know, in Wyoming, we have the Code of the West. It says if you give your word, keep it. The President promised that this health care law would actually bring down the cost of care. He said by $2,500 a family. What are we seeing with insurance costs? The costs continue to go up and up and up. The President said if you like what you have, you can keep it. That hasn't been true either. In terms of insurance people have. They are losing what they have if they like it. And even though the several pages of the health care law may have implied that, when the Secretary of Health and Human Services came out with over 100 pages of regulations, it was clear that if you get your insurance through work, big company, small company, majority of Americans will not be able to keep the health insurance that they have and that they like. Today, a recent poll today that was released said 58% of Americans would like to have this health care law repealed. The interesting thing about this, Mr. President, was that it went further. Recent polling went further to say when you poll people who have actually talked to a nurse or talked to a doctor or talked to a physician assistant or an EMT or people involved in the health care area, then those people who have talked to somebody, a care provider, even more of them want this health care law repealed. As Nancy Pelosi said, first you have to pass it to find out what's in it. As more and more people become aware of what's in it, more and more people want this health care law repealed. The mandates are excessive and they are expensive, and states with governors of both parties are being impacted by these huge expenses. You know, it's interesting, Mr. President, there was an article in Saturday's New York Times. For governors of both parties, Medicaid looks ripe to slash. Well, what's Medicaid? They're going to slash Medicaid. The headline, hamstrung by federal prohibitions against lowering Medicaid eligibility. Governors from both parties are exercising their remaining options in proposing cuts to the program. Well, Mr. President, I've just heard other colleagues on the Senate floor talk about this huge expansion of Medicaid. That's the solution. That's the President's solution. That's the Democrats' solution. Cram more people onto Medicaid, a program initially designed for the poor with low reimbursement rates, where over half of the doctors in the country won't see Medicaid patients, and that's the solution. I listen to my colleagues on the other side of the aisle talk about coverage and talk about care and use the words interchangeably, and, Mr. President, that is misleading to the American people. You can get a Medicaid card, but it doesn't mean you can get in to see a doctor in the way that you might think. Half of the doctors don't want to see patients. Why? Because the reimbursement is so low. So when the New York Times article from Saturday goes on, as USAID runs dry, states propose Medicaid cuts, the first governor's picture up there is Jerry Brown of California, Democrat. Under him, Andrew Cuomo, Democrat of New York. What does it say? It says the shrinking of state Medicaid programs, if approved by the state legislatures, would come at a tenuous moment for the Obama administration. That's because it says, starting in 2014, the Health Care Act calls for an enormous expansion of Medicaid eligibility that is expected to add 16 million beneficiaries by 2019. The health care law puts in a proposal and a program that will hire IRS agents to make sure people buy health insurance, but it doesn't pay to train the doctors and the nurses needed to take care of those patients. And as the article goes on, it says states have already cut payments to health care providers and scaled back benefits over the last few years, so these new proposed cuts are much more painful. I will tell you, Mr. President, for the people of Wyoming, and I'm going to in a second talk about an article, the people of Wyoming want this law repealed. The chairman of our Health Committee in our state Senate, and I served under him for 5 years when I was a member of the Wyoming State Senate, is named Charles Scott. He has been in the state Senate for over 2 decades, studies this extensively, and he had an article in the Casper Star Tribune on January 30th. And, Mr. Chairman, I ask unanimous consent to include this in the congressional record.
Without objection.
And the headline is, Repeal of Obamacare Would Help Wyoming. And just a few excerpts, Mr. President. He says, the Obamacare law is a disaster for our country, and especially for Wyoming. He said, our American health care system costs too much. There are too many uninsured. Obama reform makes these problems worse, He goes on. The centerpiece of the Obama effort to ensure the uninsured is to expand the Medicaid program, the existing program for poor people. This, he says, is the most expensive way available to insure the uninsured. The most expensive way to insure the uninsured. This is someone who studied this for 20 years. The Medicaid program is designed to be a high-cost program. The federal government has required a set of Medicaid benefits that are richer than any insurance the rest of us can buy. The feds forbid most of the effective cost controls the rest of us face. He goes on. One consequence is that Medicaid clients are free to use the hospital emergency room for things most of us take care of at home. The health care costs for an adult in Medicaid are 1.5 times larger than for a comparable adult insurance by our largest private insurer, and a child on Medicaid costs 2.5 times as much. Those are the things that we're dealing with. That's the solution that the Democrats have presented to the country. That is what has been passed. This solution is not a solution. What we need to do is repeal and replace this health care law. And I will tell you, Mr. President, the American people notice when month after month the Secretary of Health and Human Service rolls out more waivers for people under this health care law. Last week, she granted 500 new waivers. We now have 2.2 million Americans who this law does not apply to. They've gotten their waivers, doesn't apply to them. You say, well, who are these people? Well, they're people with friends in high places. 166 of these are union benefit funds, 166 covering 860,000 Americans. These are the same union members who, many of them, lobbied Congress, contributed in ways to say we need this health care law, and yet they say, oh, once we've looked at it, once we followed Nancy Pelosi's idea and actually read the bill to find out what was in it after it got passed, we don't want it to apply to us. 40% of all of the waivers have gone to unions, even though union workers only account for 7% of the private workforce in this country. Well, if this health care law is so great for the country, why should companies and unions need waivers? And why can't the rest of America receive a waiver and get the same treatment? And that's why I come to the floor today, Mr. President, and tell you this health care law is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and it's bad for the taxpayers. And by voting to repeal this health care law, we will give these waivers to every American and give them the opportunity and the freedom that they request and the flexibility that they need to get the health care that works best for them, not a one-size-fits-all approach that comes out of Washington, loaded with Washington wasteful spending. Thank you, Mr. President. I yield the floor.
Mr. President.
From South Dakota.
Mr. President, I wish to add to the comments that were made by my colleague from Wyoming who, in his former life, being a physician, understands this issue probably better than any of us here in the chamber. And I think he very eloquently pointed out why this amendment that we're hopefully going to be voting on that will repeal the health care law is so important. You know, obviously there's a big debate that's been raging in the country over the past year about this legislation as it was being considered here in the Congress. And I think the one thing that is clear about the public's view of this is they think it was a bad idea. And that hasn't changed. That was true a year ago, that was true 6 months ago, and that's still true today. And I think that the administration had tried to argue that they had merely done a poor job of communicating to the American people how great this health care reform idea was. But that excuse misses the point entirely. The American people, Mr. President, are not clueless. They know a bad idea when they see one. And they understand that the Democrat health care plan was a bad idea. And despite the administration's full-court PR press in trying to reverse the public opinion about this, the health spending law remains unpopular in polls. In fact, as was quoted by my colleague from Wyoming, there was a poll that came out today where 58% of likely voters in a recent Rasmussen poll favor repealing it. In fact, if you drill down a little bit further into that survey, it says 47% strongly favor repeal. 38% oppose repeal, 29% strongly oppose repeal. But you've got a decisive majority in this country, 58% of the population saying they would like to see this repealed, and nearly half strongly committed to that position. So notwithstanding efforts by the administration to reverse the public's view of this, the American people still get it. And I think that the administration had hoped that this would get behind them, that people would start, once they were educated about the benefits of this, come to a different conclusion. But I think they see clearly now that that hasn't happened. That hasn't been the case. So this whole health care law has failed the test of being something that the American people think is important, something that they want to see done. Now, I don't doubt for a minute that they want to see the issue of health care addressed in this country, health care reform. Unfortunately, this particular proposal didn't do anything to reform health care. It expanded health care dramatically, and it expanded the cost that most people are going to bear when it comes to paying for their health insurance premiums. And so it failed the test of public support of the people in this country who have been following this debate very carefully because it affects them in a very personal and profound way. Health care is something that every American understands. It's something they get, and regrettably, they have turned I shouldn't say regrettably, it's regrettable that we passed it. I think the American people have turned a thumbs down on it, and that should speak to the importance of this amendment in us trying to go back and do this the right way. The other test that it failed, which everybody here talks about, and there's a great deal of lip service and a great deal of rhetoric paid to the issue of jobs. And honestly, I think if there was a message coming out of November's election, it was this: the American people want us focused on three things. They want us focused on jobs, they want us focused on spending, and they want us focused on debt. Now, on the issue of jobs, this also fails the test. Why? Because it raises taxes so dramatically. If you look at the tax increases in the bill, $569 billion in taxes on virtually every sector of the American economy. For instance, the measure penalizes employers for hiring more workers by raising the Medicare payroll tax by $210 billion, leaving new taxes on many small businesses that will serve as the engine of economic growth and job creation. And if we want to get this economy recovering again and creating jobs, one thing you don't want to do is impose new mandates, new burdens, new taxes, new regulations on the economic engine, the job creators in America today, and that's our small businesses. And so the issue of jobs, if we're serious about jobs, this certainly didn't do anything to create jobs. And I think the American people made it very plain and very clear: we want you focused on jobs. We want you exclusively focused on getting this economy back on track, creating jobs, getting the American people back to work. So it failed on that test. How about on the test of spending? Well, you know, if the American people, I think, understand a very sort of basic sort of adage, if you want to call it that, and that is when you're in a hole, you don't keep digging. And what we have done is we have dramatically expanded the size of government at a time when we're running year-over-year trillion-dollar deficits. So what did this do? Well, when it's fully implemented, it will increase spending by $2.6 trillion. That's the 10-year score between 2014 and 2023. It's a massive expansion, the most dramatic expansion that we've seen of government literally since the 1960s. And so it doesn't do anything to address the issue that the American people spoke loudly about, and that is getting Washington spending under control. Now, arguably, as I said before, I think they care deeply about the issue of health care and getting health care costs under control. As I'll get to in a minute, this doesn't do little, if anything, to address their health care costs, but it certainly increases federal spending and increases the role and the size of government at a time when most Americans are saying, we want the government reined in. We want less government. We want the government to start living within its means. Instead, we've increased and expanded the size of government dramatically. Now, how about the issue of debt? A lot's been made by our colleagues on the other side that if we were to repeal this, it's going to add to the deficit. Well, let's go back to the reason why they can make that argument, Mr. President. And the reason they can make that argument is because of all the gimmicks, all the phony accounting that was included when this bill was passed in the first place. We've all referenced and talked about the double counting of Medicare savings to the tune of about $400 billion, new payroll taxes, savings that are supposed to be achieved by reductions in Medicare spending, double counted both as a pay-for, an offset to pay for the new health care entitlement program, and as a credit to the Medicare Trust Fund. You can't double count. You cannot score these things in a way that dips into the same revenues twice, Mr. President. And that was one of the great, I think, ironies of this legislation when it was being debated here, that issue did not become more fully discussed. The way that this thing was accounted for and the way in which the trust funds were credited with saving or extending the lifespan of Medicare at the same time that the same dollars were being used to pay for this new health care entitlement. You can't spend the same money twice. And that's exactly what happened. And the American people get that. I cannot feature any other place in America where you could get away with what happened here during the health care debate. So you had the $400 billion, $398 billion to be exact, that was double counted in Medicare. You also had $29 billion in Social Security revenues that were double counted as well. The Social Security Trust Fund was credited with $29 billion. At the same time, the revenue that was coming in from higher Social Security payroll taxes because of some changes that were made in the legislation was counted to pay for the new health care entitlement. So you had Social Security and Medicare payroll taxes that were double counted, that were essentially scored twice to credit the Social Security Trust Fund, the Medicare Trust Fund, at the same time they were being used to finance the new health care entitlement. Add in the $70 billion that was listed as revenues to pay for this from a yet new entitlement program called the Class Act, which is a long-term care entitlement program. And as was described by my colleague from Wyoming, even the Senate Budget Committee chairman, the senator from North Dakota, described the Class Act as a Ponzi scheme of the highest order, something that Bernie Madoff would be proud of. And yet $70 billion was scored as being used as a revenue raiser to pay for the new health care entitlement program, knowing full well that at some point in the future, the people who paid premiums into this new program were going to demand some sort of, when it came time to stake a claim against that trust fund, that those benefits were going to have to be paid out. So in the out years, it dramatically expands and explodes the deficit, even though in the near term it was counted as revenues that were used to shield the true cost of the health care bill. Well, if you add in the cost of implementation, which turned out to be about $115 billion, something that wasn't discussed or included in the debate, nor was it included in the initial CBO score, you have about $208 billion cost to do the doctor's fix, to take care of the physician fee issue, which will be coming to us and which was left out of this bill so as to understate the true cost of the bill and to put it into balance. My point, very simply, Mr. President, is by any objective measure, if you look at the games that were played, the gimmicks that were used, the phony accounting that was used to claim that somehow this was going to be a positive impact on the deficit, it just doesn't pass the smell test. No rational American would look at this and say, this makes any sense at all. Now, in fact, if you add up everything I just said, if you take all these accounting gimmicks, all the phony accounting that was used here, and you offset that against what is claimed as a budget savings in this, you actually get not a $143 billion savings, you get about a $700 billion deficit. That's what we'd be looking at over the 10 years. Now, remember also that you also had the 6 years of spending in this bill in the first 10-year window, which is what the CBO used to score this, and about 10 years of revenues. So the tax increases start right away. The revenues are counted immediately. The spending doesn't come until later. You front load the revenue, you back end load the spending in that decade and try and claim that somehow this thing balances out. Again, the American people see through this. They get it, which is why they have taken the position they have on the health care bill in the first place. So on the test of debt, on the test of how does this impact the deficit, how does this impact America's long-term fiscal standing, this bill is a failure. One other point I'd like to make, because, again, I wanted to come back to it earlier. I think a lot of Americans were hoping that when Congress took on this issue of health care, that it actually would be with an eye toward reducing the cost of health insurance premiums for most Americans. What we're seeing is the contrary. Actually, what we predicted would happen is coming true. Many of us who were involved in that debate said at the time that this thing was going to lead to higher health care costs for most Americans, and it's actually true. And actually, the CBO said the same thing. They said that the individual health insurance premiums would increase by about $2,100 per family as a result of the new law, and that some consumers would face total premium increases of more than 20%. Well, those are things that we're seeing come to fruition now. A lot of people are seeing their health insurance premiums go up. That's just a fact. It's a reality. It's complete contradiction of what was promised when this bill was being debated. But you have not only higher taxes on small businesses that are costing us jobs, that are destroying jobs. You have this massive expansion of spending. You have the debt and the deficit, which in the out years is going to explode because of all these accounting gimmicks. And then when it's all said and done, you still haven't done anything that lowers health care costs for most Americans. And I believe that most Americans, that's what they wanted to see come out of a health care debate in the Congress. They wanted to see reforms passed that put downward pressure on health care costs to them and their families rather than increasing it. And in fact, what we've seen is the opposite. It hasn't decreased costs, it has increased costs, and I think you're going to continue to see costs go up because as these tax increases start to kick in, a lot of these businesses around the country obviously are going to pass these costs on to the American consumer. And so it fails the test of doing anything really to lower costs for most Americans. Finally, Mr. President, it also, I think, now is failing the legality test. As you're seeing now, these courts are coming out and determining that this whole exercise was unconstitutional. And so that triggers a whole other debate in this country, a debate that I think we're going to watch probably for a while, but I hope as this thing moves through the courts that it does engage the American public about what is the role of the government and how intrusive should it be and what kinds of mandates can it impose on the American people. It was a very well-reasoned decision that came out of the Florida court yesterday which says that this legislation is unconstitutional. Again, that makes the argument that many of us were making as this was being debated last year. But the bottom line is we are in a position to do something about it. This isn't the end. This shouldn't be the end of the debate. We should look at this as an opportunity. If the amendment that was offered by the Senator from Kentucky, Senator McConnell, actually were to pass and we were to repeal this, we could start over. We could go about this in a way that actually does reform health care in this country in a way that lowers costs rather than raises costs for most Americans. And I think that would be a welcome thing for the American people. Now, the other side is going to argue we don't need to do this, we don't need to repeal this, we just need to, quote, repair it. We can make these little modifications to it. But the fundamental fact, Mr. President, is this was a mistake in the first place, and we should acknowledge it. And I think, again, the fact that it passed last year on a total party line vote, a total partisan vote, there wasn't a single Republican here in the United States Senate that voted for this. And usually when you're doing big, bold things, if you look historically in this country, it's done in a bipartisan way. It's done in a way that incorporates the best thoughts, the best ideas, the best input from both sides. And you generally get a bipartisan vote in support of something like that. This was passed, party line vote. It's now facing a challenge, and I think a very direct challenge in the courts, which is going to play out over the course of the next several months. But we here in the United States Senate could do something by repealing this law and starting over and going about this the right way. And that isn't to say for a moment that there aren't issues that need to be addressed with regard to health care in this country. And many of them have been touched upon by speakers who've come down here before me. But there is a better way to do it. There is a way to do this that doesn't dramatically increase the size and expansion of our federal government, that doesn't add and explode the debt in the out years, that doesn't raise taxes on our small businesses when we're asking them to create jobs, that actually does lower the cost of insurance, health care insurance for most people in this country rather than increasing it, and is done in a way that's consistent with what our framers intended in terms of the basic parameters that are allowed by our Constitution. And so I would hope, Mr. President, that the McConnell amendment will get voted on. I think it's important for all of us, obviously, to be on the record on this, but I would hope that my colleagues on the other side might reconsider the position that they took when this was voted on last year and conclude with many of us that this was a failure and that starting over is the very best solution for the American people if we're serious about giving them a health care system in this country that is affordable, that delivers the high quality that they expect, and enables them to have the maximum amount of choice in decision-making authority when it comes to something that is so personal and so important to them, and that's their health. Mr. President, with that, I yield the balance of my time.
President.
The Senator from Maryland.
Mr. President, I'm listening to my friend from South Dakota, and I was thinking back about how long we've been debating health care reform, and if we were to repeal the bill that we enacted last year, how long it would be before we would be able to get back to serious health care changes. It took us a year to debate and pass the bill that was ultimately signed by the President. But it took us 30 years to get to this subject, and several administrations, both Democrat and Republican, that offered proposals where we could bring down the cost of health care and make it more available to the people of this country. We brag, and rightly so, that we have the highest quality, most technologically advanced health care in the world in the United States. I look at my own state of Maryland, and I know that people come from all over the world to get their health care needs met and get their doctors trained, whether it's at Johns Hopkins University or University of Maryland Medical Center or what's happening in NIH. And I know the President can tell us about the great institutions in the state of Pennsylvania. And that's true. But the problem is that it's out of the reach for too many Americans. It's too expensive. We don't have access to care in too many communities here in America. And the Congress last year did something about that. We took major steps forward to help the people of our nation. I've gotten hundreds of letters and phone calls from people in Maryland who told me their stories about fighting health insurance companies, or their story about trying to get access to preventive health care and how they were denied under our current system. I've talked to the seniors in Maryland, and I know how expensive health care is to them. You know, seniors are very fortunate in that they have Medicare. But seniors as an age group have the highest out-of-pocket cost of any group of Americans. There's too many gaps in the system. We have to improve the system. And the problem I have with Senator McConnell's amendment is that if we repeal what we did last year, we've got to understand what consequences that will mean, because we're not sure when Congress will be able to deal with this subject again. It might be 30 years from now. And if we just repeal the bill, as suggested by Senator McConnell, the consequences of that action, I think, will be very damaging to the seniors in Maryland and around the nation. And let me tell you why. The bill that we enacted last year started to deal with the gap in coverage for prescription drugs. Seniors last year received $250. This gap, if you spend a couple $1,000s on prescription medicines, you then have to pay 100% of the costs of your prescription medicines under current law until you spend another couple $1,000. For many seniors, they can't afford that. It means either doing without prescriptions or cutting pills in half, compromising their own health care. I've gotten many letters from people in Maryland telling me, from seniors who've said, look, I've had to leave a prescription on the counter because I couldn't afford it. And I got Medicare, and I got coverage under Medicare D, but I couldn't afford it because I fell within the coverage gap. Do something about it. It's not fair. Taking medicines keep me healthier, and I should be able to get that coverage here in the wealthiest nation in the world. Well, we did something about it last year, and the repeal would eliminate that protection. We're going to close totally that coverage gap, that so-called donut hole. And this year, 2011, the benefits are going to be worth about $500 to the seniors who fall within that coverage gap. That would be lost if the McConnell amendment were adopted and became law. We can't let that happen. I'm going to tell you, next year it will even be a better benefit. I think it gets up to about $2,400 of benefits to our seniors. That would be lost if we were to repeal the bill. But it goes beyond that. We now are providing a wellness exam every year to our seniors. They'll be able to get covered for their preventive health care. They don't have that today. We expand their benefits. We guarantee that their benefits will be provided, but we go beyond that. We eliminate a lot of the co-payments on preventive health care. We make the program stronger, increasing the benefits for our seniors. And at the same time, we do something which is extremely important. We make the program safer for tomorrow. We extend the solvency of the Medicare Trust Fund for a decade. That's what we did last year. If we repeal the bill, if the McConnell amendment became law, the Medicare system would be on much weaker ground, making it much more vulnerable to the types of attacks that some of my Republican colleagues have been talking about. Much more likely that that would become reality. That's what this bill means for the seniors of Maryland or seniors of West Virginia or seniors of Pennsylvania. That's what it means. That's what we did. We strengthened the program. That will be lost if the McConnell Amendment were to become law. But it goes beyond our seniors. It goes to all families across this nation. I can't tell you how many families I have run into who have said to me, Senator Cardin, we want to cover our children. But under the old law, once they became 21 or 22, they lost coverage, even though they still needed insurance coverage. So we changed that to 26 under this law. You're allowed to be on your parents' policy now to age 26. That's the law of the land right now. The McConnell Amendment will repeal that. We'll tell these young people who perhaps have graduated from college and maybe in their first job, but they don't have insurance available to them, that they will not have an affordable option for health coverage. They can't be on their parents' policy. Do we really want to do that? That doesn't help American families. That moves us in the wrong direction. We've told the private insurance marketplace that your premium that you pay, whether you do it through your work and your employer and your own contributions or the premium that you pay, that most of that premium should go for health benefits. It shouldn't go for bonuses for insurance company executives. It shouldn't go for non-medical expenses. Most of it should go for benefits. And the bill we passed last year says that now 80 to 85% of the premium you pay for your health insurance must go for benefits. And if it doesn't, you'll get a rebate. The money will actually come back to you in your pocket. That's taking on the private insurance companies, telling them that they have to work within at least acceptable ranges. That's going to provide real benefits, improved coverage for the people of this nation. If the McConnell Amendment were to become law, that would be lost. You truly would be at the mercy of your private insurance companies. How many constituents have we heard from who've told us the examples of the insurance companies using pre-existing conditions to block their coverage? I could tell you about a family in Montgomery County, Maryland. A husband and wife and 2 children had to take out 2 insurance policies because the insurance company said that one of their children had a pre-existing condition. They had to take out 2 insurance companies, 2 insurance plans paying 2 premiums and 2 deductibles. Well, that's outrageous. We've done away with pre-existing conditions for our children. And we're going to do away with pre-existing conditions for all Americans, as we should. You buy insurance to protect you. I was really surprised to learn of how many Americans, if they try to buy insurance today without government protection, would run into an insurance company and tell them that they have a pre-existing condition. If you have high blood pressure, even if it's under control, pre-existing condition, God forbid you should need to see a cardiologist, not covered. If you have high cholesterol, you take a pill, it's under control. You think you're in good shape because you can eat whatever food you want to, and your cholesterol numbers are still good. Not for your insurance company. That has been considered a pre-existing condition. If you're a victim of domestic violence, that's considered a pre-existing condition. Quite frankly, I think some insurance companies considered women to be a pre-existing condition, the way they wrote their policies. Well, we do away with that. And if the McConnell Amendment were to become law, all that protection that was done last year is gone. And if you think we'll be able to pass it again quickly in this Congress, come down here and watch the way Congress works. 30 years it took us to bring this bill up and to get it passed. These are protections that are critically important to families in this nation. And we need to make sure that these are protected. Caps. You buy an insurance plan and all of a sudden you find out you have annual caps and lifetime caps, and what you thought you were buying, protection against catastrophic, it's not there. We've done away with the caps, protecting American families. That would be gone if the McConnell Amendment were to become law. I've heard a lot of discussion on the floor here about small businesses. I tell you, one of the reasons I worked so hard for the passage of the Affordable Care Act is to help small businesses in our community. They are discriminated against. It costs a small business owner more for the same coverage for its employees as a large company. On average, it's about 20% higher for smaller companies to insure their employees. That's wrong. That's just wrong. We take steps to correct that immediately by giving small businesses a credit we help them make it more affordable for them to cover their employees. Now, I heard my colleagues complain that premiums are going up. Yes, premiums are going up because of the current system, the one that we have changed, are in the process of changing. It's going to take some time for us to get full implementation of that law. That's understandable. It's wrong. I wish we could do more to bring it down quicker. But for this bill, the premiums will be even higher. We know that. This bill helps us to start to get a handle on helping small businesses have affordable coverage for their employees. And once again, the McConnell Amendment were adopted, it became law, that protection, that help for small businesses would be lost. And then let me talk about taxpayers for one moment. There's a lot of discussion on both sides of the aisle, and I hope we are able to reach an agreement to bring down the deficit in this country. We need to do that. We need to do it for the sake of our economy. We need to do it for our children and grandchildren. It's wrong for us to pass on our debt to future generations. We need to be serious about deficit reduction. And I hope we do come up with a game plan in order to bring that about. But you don't do that by repealing the health reform bill that our own Congressional Budget Office, our independent evaluators, tell us that by repealing this bill, we'll add about $1.5 trillion to the national deficit over the next 20 years. Now, I know that people who are listening to me may not believe what I say. I understand that. I understand there's been a lot of misinformation that's been given out there. And my colleagues on both sides of the aisle have tried to oversell this. But let me tell you something. The Congressional Budget Office is our independent evaluator. I remember when Senator Rockefeller was working on this bill, and we thought we had a pretty good understanding on how to bring the bill out. But unfortunately, the Congressional Budget Office said we can't give you all the savings that you think you're going to get by keeping people healthier. Well, Senator Rockefeller and the Finance Committee had to go back and find some additional savings in order to meet the Congressional Budget Office's requirements, so that we made sure that we didn't add to the deficit in the country. In fact, we reduced the deficit of the country with this bill. So what do my Republicans in the House do, my colleagues do? They say, well, Congressional Budget Office doesn't mean anything. If we do that with every bill we pass here, Mr. President, we will never attack the deficit of this country. We have to have objective rules for evaluating what we do, what impact it has on the deficit of America. One thing is clear by the objective scorekeepers. The McConnell Amendment will add $1.5 trillion to the national debt because of what we were able to do in the Affordable Care Act. Now, we could argue this from many different sides. I always am amazed that my friends on the other side of the aisle say, look, well, this is what the American people wanted us to do. I've looked at all these polls that go back and forth, and Americans are divided on this issue. But most Americans want us to move forward. They want us to deal with job creation and job growth, and that's exactly what the bill that my friend from West Virginia has brought forward in the FAA bill. And I'm going to talk about that at a different time, Mr. Chairman. I tell you, it's a very important bill for the American people. It's going to make our air traffic safer, but it's also going to create more jobs in our community, the exact type of bill that we should be bringing forward. We should be working today to create more jobs and keep more jobs, and that's what this underlining bill does, not the McConnell Amendment. That won't help us create jobs. That will add to the deficit, make it more difficult for Americans to keep and get affordable health care. That's not what we should be doing. And I do invite my Republican friends. We should be working together on this bill. We should be looking at ways to improve health care in America. We never said that we completed our work last year. We know there's more work to be done. We know there's ways that we can improve health care in this country. Let's work today to do that. But let's not go backwards. Let's move forward for the American people. Let's create the jobs that we need for our economy. Let's continue to make health care accessible to more and more Americans and affordable to more and more Americans. And let's provide the quality care that's befitting this great nation to all of our citizens. In my own state of Maryland, we have a person who we will never forget, DeMonte Driver, 12-year-old who lived in Prince George's County, Maryland, in the wealthiest nation in the world. In 2007, needed to see a dentist, but had no health insurance. So his mom tried to get him to a dentist, and no dentist would treat him because he had no money. So he went to a social worker. Parents went to a social worker. His mom took him there. Made a lot of calls. No one would treat him. His condition got worse, and he went to an emergency room, which is what happens with a lot of people who have no health insurance. You talk about saving money. One of the ways we save money under the Affordable Care Act is to bring people out of the emergency rooms into preventive care, into our clinics, and get them the health care they need. The Monty driver went to an emergency room months after he should have seen the dentist because his tooth had become abscessed and had gone into his brain, and he had severe headaches. He went to the emergency room because of his headaches. And they found that the only way they had a chance to save his life is through emergency surgery. 2 surgeries later, $250,000 spent, where it would have cost $80 to take care of his need, the Monty driver lost his life. In 2007, in the wealthiest nation in the world. I understand health care is personal to every person in this nation, and that everyone looks at how they're going to be taken care of in this health care bill, and that's the way you should. We think the overwhelming majority of Americans benefit by the bill that we passed last year. But I would hope every American wants to make sure we have no more DeMonte drivers. That every person in this country has access to affordable, quality care. And that was the signature accomplishment in the last Congress. We did it in a way that helped our seniors, that helped our families, that helped small business, that helped our taxpayers, and helped America to become, at long last, a nation that said health care is a right, not a privilege. All that's lost if the McConnell Amendment were to become law. I urge my colleagues to think before they vote on this amendment as to whether you want to be on the right side of an issue that I think helps define the nation that we are. I urge my colleagues to reject the McConnell Amendment. And with that, Mr. President, I would yield the floor.